Multiple sclerosis, often referred to as MS, is a chronic disease. It affects the central nervous system, or CNS. The CNS is made up of the brain and spinal cord. MS disrupts the flow of information within the brain. It also affects how the brain communicates with the rest of the body. Imagine the CNS as a network of wires. These wires send signals throughout the body. In MS, the protective covering of these wires is damaged. This covering is called myelin. Damage to myelin disrupts the transmission of nerve signals. This disruption leads to a variety of symptoms. These can include vision problems, muscle weakness, and difficulty with balance. MS is an unpredictable disease. It affects everyone differently. Some people may experience mild symptoms. Others may have more severe disabilities. There is no cure for MS, but treatments are available. The nervous system is like the body's control center. It receives, processes, and transmits information. This allows us to move, think, and feel. The brain and spinal cord are the main components of the CNS. Nerves are like wires that carry messages throughout the body. These messages travel in the form of electrical impulses. Myelin is a fatty substance that surrounds and protects these nerve fibers. Think of myelin as the insulation around an electrical wire. It helps to speed up the transmission of nerve impulses. In MS, the immune system mistakenly attacks the myelin. This attack causes inflammation and damage to the myelin sheath. When myelin is damaged, nerve impulses are slowed down or blocked. This leads to the various symptoms of MS. The exact cause of MS is still unknown. However, scientists believe that it is an autoimmune disease. In autoimmune diseases, the immune system mistakenly attacks the body's own tissues. In MS, the immune system attacks the myelin sheath. This attack is thought to be triggered by a combination of factors. These factors include genetics, environment, and possibly even viruses. While the exact cause is unclear, research suggests several factors may play a role. These include genetic predisposition, environmental triggers, and viral infections. More research is needed to fully understand what causes MS. Section 4. Types and symptoms of MS. There are several different types of MS. The most common type is relapsing remitting MS, or RRMs. In RRMS, people experience periods of symptom flare-ups, known as relapses, followed by periods of recovery, called remissions. Other types of MS include secondary progressive MS, or SPMS, and primary progressive MS, or PPMS. These forms of MS have a more progressive course, which means that symptoms gradually worsen over time. The symptoms of MS can vary widely from person to person. Common symptoms include fatigue, vision problems, muscle weakness, and difficulty with balance and coordination. Other symptoms can include numbness or tingling, bladder problems, and cognitive difficulties. Section 5. Living with MS treatments and support. While there is no cure for MS, treatments are available to help manage symptoms, slow disease progression, and improve quality of life. Disease-modifying therapies, or DMTs, are medications that can help reduce the frequency and severity of relapses in RRMs. Medications and therapies can help manage symptoms. These include medications to reduce fatigue, improve bladder control, and relieve muscle stiffness. Physical therapy and rehabilitation can help maintain mobility and independence. Lifestyle modifications, such as regular exercise, a healthy diet, and stress management, can also play a role in managing MS. Support groups and counseling can provide emotional support and coping strategies for individuals and families living with MS.